I like to do my banking. And I've got access to my bank cards with support. But I do have a habit of overspending, so I do have to be careful.
I think we all do that.
Yeah, we all.
We all spend a bit too much.
I'm glad to be making people aware of autism and making a difference to people's lives.
It's more Rachel doing the talking, it's not me, because she's the trainer as well. It's a co-delivery, so it's about her experiences, how she lives with autism.
I'm able to help them find strategies and able to help them realise that it's not an illness and that they don't have to look for a cure for it. I can still have a paid job, but just one that's autism friendly. Because obviously if I worked in McDonald's, I don't know if they would be so understanding, if they would let me use my St. Giles and they'll say, why are you playing around not doing your job and that.
On Rehability, the Social Care Chronicles, I'm joined today by Rachel and by Subia. We're here to talk about the positive impact that Oliver McGowan training is having on the company here at Rehability UK, and that's for everybody involved, for the people we support, the people who are giving the care, and also the wider company. Thank you for coming. It's good to have you.
Thank you.
Thank you for coming, Rachel.
You're welcome.
When you first heard the story about Oliver McGowan and what happened to him, how did that make you feel?
Sad, because I think they sort of made reasonable adjustments for them.
Yeah. And from the story, what sort of reasonable adjustments have you learnt has really helped you?
Well, when I go to hospital, I take a teddy with me, and people don't always think it's age appropriate, but it's okay because I keep it in a rucksack away from them. And the doctors and nurses should, because they diagnose autism and learn a bit, or they have experience, they should know that having a teddy with me is fine and it's not going to hurt them. So I take a teddy with me, or a stress ball, or whatever I need, and that's the reasonable adjustment I have. And sometimes I go to a quieter waiting room. I use these as banded earplugs if a quiet room is unavailable. Yeah, so they could have made reasonable adjustments for him. They could have given him, well, if he didn't have stress balls with him, they could have borrowed them from the children's ward or something.
Yeah, they could have helped him more adjust to what was going on when he needed treatment.
Yeah.
Rachel, in the past, have you faced some of the difficulties Oliver's had in when you've been going to visit GPs or hospitals?
I went to a hospital. I had a poorly foot. It was black, and they said, "Why you come here?" And I said, because I wanted to prescribe some medication because my foot, because I'm on benefit and my medication gets funded through the NHS, and they said, you're wasting our time being here. I said, I'm not. I might look able. I have got a diagnosis of autism. I am entitled to a free prescription,
Yeah. So how did that make you feel when they were sort of
I've got to
questioning?
forgive them now.
Yeah.
Because we're all learning, and the doctor won't be the first person to make a mistake.
Sure. Now, have things got better for you when you're going to appointments like that?
Yeah, definitely, because I take my own stress items. I've got my disability awareness card, and people are just a lot more aware of autism now.
Sure.
That not everybody who's got learning difficulties or special needs looks different.
Sure. So, Subia, how did you get to meet Rachel here, and how did you become aware of the need that we needed to get people involved with our training?
I think part of the Oliver McGowan, when we went for the training, it was mandatory, it has to be done with a person who lives with autism. I put out in our ROMs and RAMs meeting, and I sent out an email to all the managers, because the managers are present there, and the regional managers, and asking that if they have anybody, that we can get trained up. In the services, and I had a slow response at the beginning, because I don't know, maybe because people didn't want. Sometimes people change their mind and they don't feel comfortable in doing it. And then we was lucky that when I did go to the ROMs and RAM meeting, where Rachel lives in Leicestershire, the regional manager, he said that I'll get some from our service, so that's how I was met with Rachel. I didn't meet Rachel before we sent her for the training. She went with, and when she came into the training, she was so bubbly. I think, what was your, can I ask her a question? Yeah. How did you feel, the first time you met me on the training? Because obviously you went for the training in Stafford first to be
but
trained.
a bit nervous.
Yeah. Obviously I felt nervous as well because I was thinking, oh, are they going to like me? Are they going to be comfortable with the training, delivering the training with me? But Rachel and we get on really well. So she's part of the team now, aren't you, Rachel?
Yeah.
Yeah.
So, Rachel, when you were first asked to become a trainer, what did you think and feel at that point?
I hope it doesn't affect my benefits. And I'm glad to be making people aware of autism and making a difference to people's lives.
When you got into the training, the first steps of the training, what did you learn that made you want to be a trainer?
I just want to create more awareness of autism and hope that people become more understanding a bit.
Right. You've talked a bit about your autism and how that's affected you in the past, but what's changed for you since you've been supported by Rehability?
Well, I used to self-harm a lot, and I used to run away. I used to just be a really violent person, but now I'm a lot more calmer. I don't self-harm anymore.
Yeah. And what reasonable adjustment was made at your house?
A sensory room. The fact that I'm allowed to sleep with teddies, and nobody says, oh, you're too big to sleep with teddies. Everyone's got awareness of my autism and that it's my room. I can have teddies if I want there.
Yeah. And that gives you a sort of sense of safety and it helps you, doesn't it?
Yeah.
Yeah. Do you have any other items in your sensory room that help you?
All of them help as much as each other.
Yeah. And do you have any sorts of lights?
Yeah, I have bubble tube, I have lava lamps, I have autism lights, I have a rocking chair, I have a weighted blanket, I have dog toys, I have fidget toys, I have every kind of fidget toy, most kind of dog toys, a few rattles and a few toy cars and all, because, I can roll them on me and it can feel like they're massaging me.
Oh, brilliant. So all of that helps you, and those are the kind of things that make your life work now.
Yeah, even just some action figures, just the texture of them helps, yeah.
When you're in the training, do you tell people about this as well?
Yeah.
Once you've gone through the first training, that was with the NHS, is that right?
Yeah.
So what happened during that training?
There was majority of the people on the training was all from NHS.
Right.
And so practitioners, like GP, and like nurses and that, and there was only me and Teresa, my colleague, who were from social care. So basically they put the places that they offered me went to the NHS because it was their failure before, right? So, and they had the funding, so they put a lot of money into making sure that they make the reasonable adjustments, and they're all trained, because the failure was they didn't know and have an understanding of autism, and obviously sometimes the disability it's not visible.
Unless you're wearing a helmet where you constantly bang your head in that.
Yeah, that's what I mean. So it's not visible. And
or you have a assistant's dog or something, or assistant's cat, then it can be a little bit visible, can't it?
Yeah.
But it's not the disability in itself invisible, it's what you got to help you with it.
Even though we're in our department, like social care, we have, like I said, the our passport. So on there it tells everything about, their condition, what their likes, dislikes are, and what they need when they come, if they go to any appointments or anything. Now, on my training, obviously, for us, because we already come from the learning disability and autism sector, well, I've always worked in it as a registered manager as well. We're already aware. We already know that, what reasonable adjustments we need to make working in a person-centred way, even with using that platform, Nourish, recording everything on there, where for the NHS who were on the training, it was very new to them. Right. Yeah, so it's a learning curve for them. But it's still, we still learned that, how the training is supposed to be run, and getting the people that we support involved in the training. That would have been a challenge, because I think they found that a challenge because they don't have that facility, because we do. because obviously we're social care, and that's what we do, don't we? Provide services for people with LD and autism. So we can use the people that live within our services and get them trained, which has worked wonders.
So when you were in the training, for your training, Rachel, when you were doing that first time round, how did that feel, and who did you meet?
I met lots of staff, and I met Robert,
And so when you were like learning together, what did you learn on that course that helped you become a trainer?
I learned that some people with learning disabilities do bus training. Obviously, bus training won't be suitable for me because of my anxiety.
Sure.
But I can do other things to help me. Like I can do like autism training, and I've been on the radio, BBC Radio Leicester before, to talk about my autism.
So you've been on local radio as well? And
Yes.
So would you say that now that you've become a trainer, how else has that given you confidence?
It's just made me realise that I can still have a paid job, but just one that's autism friendly. Because obviously if I worked in McDonald's, I don't know if they would be so understanding, if they would let me use my St Charles, and they'll say, why are you playing around not doing your job and that.
Yeah. What things do you do now that you didn't do before?
I go for meals out regular. I like to do my banking. And I've got access to my bank cards with support. But I do have a habit of overspending, so I do have to be careful.
I think we all do that.
Yeah, we all.
We all spend a bit too much.
Do a paid job now, whereas before I was just doing volunteer work.
Sure. Subi, when you were doing the training with Rachel, what are the kinds of discussions that you have during the training sessions that you're giving together? How does it help having Rachel in the room?
It does, because she can speak about her own experiences, that she looks at the training that I deliver as well. But it's more Rachel doing the talking, it's not me, because she's the trainer as well. It's a co-delivery. Yeah. So it's about her experiences, how she lives with autism, and what happened, from childhood to where she is
like
now.
All the schools I've been through, not having the right funding and that.
Right.
Yeah, like having to move around to school, having to partly be educated at home. Sure. And having to go to school half in the morning, and then being educated at home in the afternoon, and then eventually losing my one-to-one and having to move to Blade, and then my one-to-one getting cut, and then me having to go to a specialist school, Coddington Court.
When you're telling the story to people, what do they say, and what do you think they learn?
I think some of them are surprised that the education system is not actually as good as what people think it is. Yeah.
Going through what you've been through, are you able to help other people with autism now?
Yes. I'm able to help them find strategies, and they're able to help them realise that it's not an illness and that they don't have to look for a cure for it.
It's really powerful. And now that you're more aware of the adjustments that can be made to help you, how have you been able to use that in your everyday life these days with adjustments?
Well, I just feel happier. I don't feel the need to self-harm anymore, and I don't feel the need to, strip off or to lash out. I'm just a happier person.
Yeah. And so with all of these adjustments that you've made, and how do you make the adjustments within the training to help Rachel? In
the training, they make sure that, especially when the staff are there, that they ask, when they're asking the questions, put it right at the end so that they can ask. And if Rachel doesn't feel comfortable having, facing them when they ask the questions, that's my adjustment, is that she can face me. I already tell them this, the staff, but she's still answering them, to the question, but she feels comfortable.
For autistic people, you listen with your ears, not eyes.
Yes, definitely. There you go. So it's the environment. So obviously the training room, I'll make sure that it's user-friendly for her and Robert
making
as
sure
well.
that people aren't interrupting,
Yes, definitely.
Yeah.
Because when the group's big, they are told, because I put ground rules as well at the beginning of the session. Yeah, so I don't want no distractions, because it's not fair on them. as well. So making sure, that if they're on call, I'm sure they can ask somebody else or the reception admin, office manager, or, to answer their phone calls. So because the training session is about us and it's about them, we sit right at the front, but then I'm a fidgeter, you see, so I do like to get up and about, but it's not fair on me, so I have to understand that I need to stay, seated at the front with them as well, so that they're comfortable.
And
Having breaks as well in between helps them.
sure.
And now also, because of autism as well, make sure that, the structure. So if I know that I'm going to have to change the day, because they're used to a particular day, and she knows what days they are. If I need to change anything, make sure I let the service manager know that, is it okay? She hasn't got any other commitments. Do you know what I mean? So it's the structure as well for them and the routines,
And so those routines, they really help ensure that everything goes smoothly. Yeah. And now that you've been doing the training, how many training sessions have you given now so far?
It's been a slow process because obviously they had to be trained as well. But now we're moving. I think we've probably done about 7.
That's quite a lot.
Yeah.
When you're in these trainings with how does Rachel deliver that training and that experience?
Oh, she's very confident. Even when I'm going, to deliver my session, she'll say, "Do you mind?" She'll ask me that, "Can I answer that?" So this is how, and I say, obviously it's your session as well. Sure. So you're the co-trainer, so you go ahead. She's brilliant at it.
Thank you.
Now that you're doing this job and delivering those training sessions, what sort of conversations have you had with staff in the training?
A bit about their difficulties and all, yeah.
Cool. And so when you're in the training, do you tell what type of things do you tell them to?
Well, mostly they have different coping mechanisms to me, but that's okay, yeah.
So what you're trying to do is get people to think, is that right?
Get people to see if it works for them, if not, to use something else like whatever works for the person.
And so when you're connecting with them, and what sort of things do you suggest to people to help them with?
I told them what I use, and then I give them the option if they want to use their own, yeah.
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 Now that you've done so much training now, you're almost you're a lived expert and you're a real expert. What have you been able to do now that you can do to help people living with autism?
I can get people out of crisis, like who are in mental health crisis. Like if somebody's self-harming, I can say it's okay. It's not going to last forever. You can use coping mechanisms and that, and just reassure them. It's
really amazing that you're doing that. What would you like to do next in terms of your training?
I'd like to keep to my training, if I'm honest. Yeah.
Yeah. And what future do you see for the training using people with lived experience?
I know what I'd probably like to do, some charity work.
You'd like to do charity work as well?
Yeah, charity work like fundraising.
So you could then use all the skills you've learned to tell people about.
Yeah, and to raise money, for the autism. It's like we're doing a fundraising event soon, aren't we?
In the last training that we delivered, because in April, we said for April, we thought I'll go over there to raise some, money for the National Autistic Society.
And Autism Together.
Yeah, and Autism Together as well.
Yeah. That would be amazing that out of this relationship that you've built together, that you can now do so much more positive work.
Yeah.
And Subia, so what's next now that we've done the first set of training with Rachel and Robert? What's next for the training within Rehability?
Well, obviously we're starting on Accreda, and then the head office, all the staff need to be trained across the board for Rehability. And it's involving them in...
How about training the NHS?
Yeah, no, which I said, that the next step is that we're hoping that we can deliver the training, because they've got a shortage. They struggle to find experts, so they have to use an external provider, and externally source the training. It's the experts which is the problem. Obviously, I need to do another training, like a lead trainer where I can train more other colleagues as well. So that'll free me up then as well to deliver externally with the people that we've already got, because we also need more experts within rehabilitation to get them trained if we are going, to deliver. So it's networking with the, NHS as well. Plus, because when we delivered our training, we have a number, a registered number that we're the approved trainers, and that approved number is also on the certificate when we issue after the training, and we're also on the NHS England portal. Yeah, so if they want to use us, obviously we're not networking at the moment because there's only me. So if somebody drops me a message on the NHS portal that, we're looking for training, we're struggling with, the experts. At the moment, I can't say yes because there's only me and I need to get rehabilitation trained. But, I've got a plan that we want to do that. So then I can put on the NHS portal to say that, yes, we're free, to help, we can assist and go, and it doesn't have to be the NHS, we can do the local authorities as well. Obviously, they and the CQC.
And we can go do the government, Yeah,
there you go. They need to be trained as well because they need to have an awareness of that, Oliver McGowan, because they've made it mandatory. So, yeah.
So it's basically being pushed out right across the UK in lots of different ways.
And we could also deliver it to charities.
Oh, yeah?
Because they obviously need to help people. Yeah. And they need to look after people as well. So in terms of what's happening in Devon, I heard something was going on in Devon.
I sent 2 of the experts to be trained to co-deliver with me. So next week I start rolling it out to the Devon services with them. I'm going to meet them on Monday. We're just going to run through that, how, the training and when they come in, and that make them feel comfortable as well, because obviously it's new, delivering it with me. They are very excited. So, and then next week, Tuesday, Wednesday, I'll roll out, and then I'll get the ball rolling with them as well. So in between doing the Midlands, I'll be going over there and using the experts there to deliver over there as well. One good thing there is that the venue was the room that they don't have a specific training room where I could deliver. And for the amount of people that we can train, they're using the local authority. And it's their building, so they're going to be in there. So it's good to ask them that do they want to attend our training as well. So, that's our networking.
Brilliant. Yeah. So what you're doing is trying to get it out there, trying to make sure that as many people can benefit. And you said, do you need more people with lived experience to become trainers?
We do. Because with the Oliver McGowan training, if one expert is not well, we're not allowed to deliver the whole of the training. You can't do the one session with the one expert. Yeah, it has to be both of them. Yeah, because it's a 3. So unfortunately, I'm struggling as well, just in case if they'll have other commitments as well. They might want to go on holiday, they might be poorly. So I need more experts to be trained up within rehabilitation.
So if someone wanted to become an expert, how would they get hold of you to make
Their
sure?
managers would just contact me, and then I contact NHS England that have you got any more. They usually email me to say, I'm training the experts up. Do you have any that you want to send over? What they do, they don't train the learning disability and the autism together because they get confused with their training, what they're delivering. So they do it separate.
So if someone outside of our organisation wanted to get in touch with us, would it be okay if they left a note on our website?
Yeah, that's fine.
And we can make sure that gets through to you.
Yeah.
So they could potentially become an expert
Yeah.
and work with us.
Work with us, yeah, that would be nice.
Yeah. Subia, in terms of other training modules, how do you think we can utilise people with lived experience in other areas of our training?
Yeah, we definitely can, because we don't just deliver Oliver McGowan. We cover it in the induction. It's autism, the awareness as well that they have to do. So we can involve them. That's covered virtually. virtually face to face, so they could be involved in that as well, coming into that, in the training, deliver that, so getting their experience a little bit in there as well.
Yeah.
And then recruitment, so the recruitment drive, involving them as well in that.
Yeah, that'd be amazing.
Yeah, so at the moment it's good. Obviously we're opening there's a new service opening, isn't that, in Bradford? Even though it's still going to be learning disability remote, and autism is a big focus on there, and they've that's local authority wanted autism specialist courses, which I'm going on, and another PBS lead we're going on the training, and it's so it's focusing a lot on the spell framework as well. So that will involve where we can use them as well within in our training as well. So that'll be good.
Fantastic. So from this one sort of mandatory training, we're now learning ways in which we can develop what we do, add new training modules to our organisation, and help more people.
Yeah, involving them more.
Yeah. And as this role develops for you, Rachel, what would you like to do next as a trainer?
Probably go into special needs schools and train them and all, yeah.
Really?
Yeah.
So you feel you want to get out there and help others?
Yeah, in special
learn
needs
more.
schools and mainstream maybe.
That's amazing. Rachel, if you could say one thing to someone who's watching this and they say, they're thinking about becoming a trainer, what would you tell them to do?
Go ahead. If they want to do it, then just do it. There's nothing stopping them.
Sure. And from your advice, from your experience, what was the one thing that helped you make that step to become a trainer?
Well, I was already doing training as volunteer work, so I've already had some experience. And at school, I used to do talks on my autism because I used to be in a school specifically for autistic children, Autism West Midlands. So they involved me to do some training and all.
If you could say one thing to Oliver McGowan's family right now, now that you're part of this training, what would you say to Oliver McGowan's family?
I'm sorry what happened to your son. The NHS sort of made recent adjustments, and try and forgive them, but if you can't, then it doesn't matter. I'm really sorry for your loss. I mean, they sort of made recent adjustments.
So, Subia, if you could say one thing to everybody within Rehability and the people that we're training, what would that be?
I think seeing them smile when they come to any of the training, yeah, and putting the knowledge and the skills that they've learnt from all the training into practice, it makes me happy, and our training department as well. And you can see on the training as well, when the feedback that they give it as well. And I also want to, a hand on my heart, I want to thank Rachel and Robert, because they've made a difference to our training as well, because sometimes delivering on your own, the training, it can just be, it's like repetitive, and sometimes you feel lonely delivering on your own. And then now that I've got Rachel and Robert, it's made a big difference, and it's like now they're a part of my team. Yeah,
Thank you.
Yeah, and it's just made a difference as well in my training, and I'm always thinking now, what else can I do just for all our staff, because I know they all work hard. Everybody has to do shift work, but with training it's really, really important as well. And I can see that in the future they'll all become good support workers, and they're all making a big difference as well. We've got a really good staff team throughout Rehability, diverse staff team as well, and they're doing really, really well. So I'm happy with that.
Thank you for coming today. Thank you for bringing your experience to this table and helping us learn more.
Thank you.
Thank you.